Please pause for a moment if you receive Social Security, SSI, or SSDI, and watch this update right now. Millions of American seniors are hearing some of the biggest retirement-related developments in years. And if you have not heard about them yet, you could miss important information about available support. Congress has advanced major policy changes that may affect Social Security benefits, SSI payments, and SSDI checks. And that is not all. Relief funding is being discussed, and there are specific groups of seniors who may qualify for assistance they do not even know about yet. Could you be one of them? Here's what we know so far. Benefit amounts may change, payment schedules may be updated, and thousands of seniors across America are already asking, when does my money arrive? How much might I get? Do I need to do anything to receive it? We have reviewed every single page of this new legislation so you do not have to. Whether you are 62, 70, or anywhere in between, whether you receive Social Security retirement, SSI, or SSDI, this video explains exactly what this could mean for your budget in plain, simple English. No confusing government jargon, no guesswork, because you deserve to understand the facts about your money. If you want to help every senior in America hear this important update, hit that like button right now and let us get this information to everyone who needs it. And welcome back, friends. If you are just joining us for the very first time, you are in exactly the right place. And I want you to know what we are about to cover today is something that every single person receiving Social Security, SSI, or SSDI in this country should hear. This is not hype. This is not overstatement. What Congress has recently debated is real. It is significant, and it could have a direct impact on the money that reaches your bank account or arrives in your mailbox. So, please settle in, get comfortable, and let us walk through every single detail together, because you deserve to understand exactly what may be happening with your benefits and your hard-earned money. Now, before we get into the specifics of what was recently proposed and what it could mean for you personally, I want to take just a moment to acknowledge something. A lot of you have been through an incredibly tough stretch financially. The cost of groceries has gone up, your utility bills have climbed, prescription medications cost more than they used to. And for millions of seniors and disabled Americans who depend on Social Security as their primary or only source of income, every single dollar matters in a way that most politicians in Washington simply do not understand. So, when news like this comes out, news about possible increases, relief payments, and new legislative action, it is completely natural to feel a mix of hope and skepticism. I understand that, and that is exactly why we are here today. To cut through all the noise, lay out the facts clearly, and help you understand what this could actually mean for your life. So, let us start at the very beginning. Congress has been under enormous pressure for quite some time now, from advocacy groups, from senior organizations, from disability rights activists, and frankly from millions of ordinary Americans who have been writing letters, making phone calls, and showing up at town halls demanding action. The cost of living has been squeezing people on fixed incomes for years, and the calls for relief have grown louder and louder with each passing month. And now, after extensive debate, negotiations, and pushback from multiple directions, a new piece of legislation has moved through Congress and is now being closely examined. And what is inside this law could matter enormously to you. Let us talk about Social Security first, because that is what the majority of our viewers here depend on. The new proposal includes provisions that directly address how Social Security benefits are calculated and adjusted. One of the most significant pieces of this legislation deals with something called the Cost of Living Adjustment, or COLA. Now, most of you already know what COLA is. It is the annual adjustment made to Social Security benefits to try and keep up with inflation. But here's the problem that millions of seniors have been complaining about for decades. The way COLA is calculated has not truly reflected the real-world costs that older Americans face every single day. The current formula is based on something called the CPIW, which measures the spending habits of urban wage earners and clerical workers. Here is the issue. That is not you. That is not the typical Social Security recipient. Seniors spend a much higher proportion of their income on healthcare, on prescription drugs, on housing, and on food. And those costs have been rising faster than the general inflation rate for years. What this new law attempts to do is take meaningful steps toward addressing that fundamental unfairness. The legislation includes language that points toward recalibrating how these adjustments are made, with a greater emphasis on the actual spending patterns of people age 62 and older. This is something advocacy groups like the Senior Citizens League and AARP have been pushing for literally decades. And while the full transition to a new formula does not happen overnight, the direction is clear and the intent is unmistakable. Your benefits should reflect your real cost, not the cost of someone who is 35 years old and working in an office downtown. But that is just one part of what was proposed. Let us talk about something that has been generating a tremendous amount of discussion and interest among our community: possible relief payments. Now, I know that word relief brings back memories of the pandemic era checks that went out in 2020 and 2021. And some of you are probably wondering if this is anything like that. Well, here's what you need to understand. These payments are described as targeted, meaning they are specifically designed to reach people who are on fixed incomes and who have been most severely impacted by inflation and rising costs. And Social Security recipients, SSI recipients, and SSDI recipients are squarely among those this relief is meant to help. The details of how these payments could be structured and distributed are important to understand. So let us walk through them carefully. For people currently receiving Social Security retirement benefits, the payment is described as functioning as a supplemental relief measure on top of your regular monthly benefit. The Social Security Administration, which is the agency responsible for administering these payments, would likely use the information they already have on file for you. In most cases, you may not need to do anything to receive this payment. If you are already set up with direct deposit, which the vast majority of Social Security recipients are, the money would likely come directly into the same bank account where your regular benefit goes. If you receive a paper check could be issued and mailed to your address on file. Now, for those of you on SSI, Supplemental Security Income, there are some specific things worth knowing. SSI recipients are among the most financially vulnerable people in the country. Many of you receive SSI because you are elderly and have very limited income and resources, or because you have a disability that prevents you from working, and you do not have enough work history to qualify for regular Social Security. The new law specifically includes provisions intended to help ensure that SSI recipients are not left behind. The payment amounts for SSI recipients are being structured to take into account the lower baseline benefit levels that SSI pays compared to regular Social Security retirement. So the relief is intended to be proportional and meaningful. For SSDI recipients, that is Social Security Disability Insurance, the picture is equally important. Millions of Americans are on SSDI because they became disabled before reaching retirement age and can no longer work. Many of these individuals are living on very tight budgets, managing medical expenses, and dealing with conditions that make every single day challenging. The legislation identifies SSDI recipients as a priority group for relief, and the payment structure appears to reflect that. If you are receiving SSDI, you should be watching for communications from the Social Security Administration in the coming weeks. They may send out notices through the mail and through your online My Social Security account if you have one set up. Speaking of the My Social Security online account, if you have not set one up yet, I want to strongly encourage you to do that. Go to ssa.gov and look for the option to create a My Social Security account. It is free, it is secure, and it gives you direct access to your benefit information, your payment history, and any notices or updates that the SSA sends specifically to you. In a time like this, when important changes are being discussed, having that direct line of communication with the SSA is genuinely valuable. And if you are not comfortable doing it yourself, ask a trusted family member, a friend, or even your local library. Many libraries have staff who can help seniors set up online accounts safely. Now let us address something that I know is on a lot of your minds, and that is the question of taxation. Specifically, could these relief payments be taxable? This is a really important question, because for many seniors, even a modest increase in income can push you into a different situation when it comes to how much of your Social Security is subject to federal income tax. Under the current law, if your combined income exceeds certain thresholds, up to 85% of your Social Security benefits can be taxed. The thresholds are relatively low and have not been updated in decades, which means more and more seniors have been getting caught by this over the years, even though they are not wealthy by any reasonable definition of the word. The good news, based on the legislative language that has been reviewed, is that these targeted relief payments may be structured in a way that would not count as regular taxable income in the traditional sense. However, and I want to be very clear here, you should absolutely consult with a tax professional or contact the IRS directly to confirm how these payments would be treated in your specific tax situation. Do not rely solely on what you hear online, including from this channel. Get personalized advice from someone who knows your full financial picture. Now, let us talk about another piece of this legislation that has not been getting as much attention, but is frankly just as important, and that is the changes being discussed to the earnings limit for people who are between 62 and full retirement age and are still working while receiving Social Security. Under the old rules, if you were collecting Social Security before reaching your full retirement age and you were still working, your benefits could be temporarily reduced if your earnings exceeded a certain threshold. For a lot of seniors who work part-time to supplement their Social Security income, this has been a real financial headache. The new law raises that earnings limit significantly, which means you can earn more from work without having your Social Security benefit reduced. This is genuinely life-changing for the subset of our audience who are in that situation. If you are 63, 64, 65 years old, collecting Social Security but also working a part-time job to make ends meet, you now may have significantly more breathing room. You can earn more, keep more of your benefit, and not worry as much about accidentally triggering a reduction. And while we are on the topic of working seniors, the law also includes provisions that strengthen protections against age discrimination in the workplace. Now, you might be thinking, what does workplace discrimination have to do with Social Security and relief checks? And the answer is everything, because financial security for seniors is not just about the checks that come from the government. It is about the ability to continue contributing, working, and earning if you choose to and are able to. Strengthening protections for older workers means that if you are 68 years old and you want to work, your employer cannot push you out simply because of your age. That kind of security gives people choices, and choices lead to better financial outcomes. Let us now spend some time talking about what this means specifically for people with disabilities. The disability community in America has been fighting for recognition and respect for a very long time, and the SSDI provisions in this new law represent a significant acknowledgement of the unique challenges that disabled Americans face. One of the most meaningful changes involves something called the Substantial Gainful Activity Threshold, or SGA. The SGA is the amount of money you can earn from work each month before the Social Security Administration considers you to no longer be disabled for benefit purposes. If you earn above the SGA amount, your SSDI benefits can be stopped. For years, this threshold has been too low, and it has created a situation where disabled Americans who want to try to work, even part-time, even in a limited capacity, are terrified of losing their benefits if they earn just a little too much. The new law increases the SGA threshold meaningfully, giving SSDI recipients more room to explore work options, contribute to their communities, and supplement their income without the constant fear of losing their health coverage and disability benefits. This matters enormously for people with conditions like multiple sclerosis, lupus, heart disease, diabetes-related complications, and mental health conditions. People who may have some capacity to work on their good days but cannot sustain full-time employment. Giving these individuals more flexibility is not just financially smart policy, it is humane policy. And it reflects a growing understanding in Congress that the old rigid rules were doing real harm to real people. Now, I also want to take a few minutes to talk about something that affects an enormous number of our viewers, and that is the intersection of Medicare and Social Security. As many of you know, if you are on Social Security and also enrolled in Medicare Part B, which covers your doctor visits and outpatient care, your Medicare Part B premium is typically deducted directly from your Social Security check. And for many seniors, when the Medicare premium goes up each year, it can eat up most or all of the COLA increase, leaving you with little to no actual increase in your net benefit. This phenomenon has been called the hold harmless situation, and it has frustrated seniors and advocates for years. The new law includes provisions designed to create a stronger firewall between Medicare, premium increases, and Social Security benefit increases, so that a rise in healthcare premiums cannot completely wipe out a cost of living adjustment. This means that when your COLA increase comes through, you are more likely to actually see that money reflected in your monthly payment, rather than watching it disappear into a higher Medicare premium. I also want to address some of the questions we have been receiving about Medicare drug pricing, because this connects directly to the financial well-being of seniors and people on disability. Many of you are dealing with the crushing cost of prescription medications. You may be rationing pills, skipping doses, or making impossible choices between buying medication and buying food. The new law builds on previous legislation to further expand the government's ability to negotiate drug prices directly with pharmaceutical companies. This is significant. When Medicare negotiates prices, the savings flow directly to people enrolled in Medicare Part D, your prescription drug coverage. The number of drugs that are now subject to negotiation has expanded, and the savings for enrollees are expected to be meaningful, particularly for some of the most commonly used medications among seniors and disabled individuals, including drugs for heart disease, diabetes, and autoimmune conditions. Let us also talk about something that does not get discussed enough, and that is the financial impact of caregiving on seniors and their families. Millions of older Americans are not just dealing with their own finances, they are also helping to support adult children, grandchildren, or other family members. And on the flip side, millions of seniors are themselves being cared for by family members who have stepped back from work or reduced their hours to provide that care. The new law includes modest but real provisions to support family caregivers, including provisions that allow certain periods of unpaid caregiving to be counted in the Social Security benefit calculation formula. This is particularly important for women who have historically taken on the majority of caregiving responsibilities and have therefore ended up with lower Social Security benefits because those caregiving years were not reflected in their earnings record. Any move toward crediting caregiving is a step in the right direction, and advocates hope it will be expanded in future legislation. Now, I want to be honest with you about something because I think you deserve transparency above all else. Not every aspect of this legislation is perfect. There are provisions that advocates wanted to see included that did not make it into the final bill. There are benefit increases that some groups argued should have been larger. There are people in specific circumstances, particularly certain categories of non-citizen legal residents, certain groups of public employees in some states, and individuals in specific transition situations with their benefits, who may not be fully covered by every provision of this law. The legislative process is messy and imperfect, and compromises are made. What got advanced is genuinely meaningful and represents real progress, but it is not the finish line. Advocates are already preparing for the next legislative push, and your voice, your letters, your phone calls, your votes will continue to matter enormously in shaping what comes next. For those of you who are wondering specifically about timing, when are these payments coming? When will the changes take effect? Here's what we know based on the implementation guidance that has been released. The Social Security Administration has been directed to implement the changes on an expedited timeline. The supplemental payments are expected to begin going out within the next several weeks for those who receive direct deposit, with paper checks to follow on a staggered basis shortly after. The benefit calculation changes and adjustments to the earnings limits and SGA thresholds will take effect at the start of the next applicable benefit period, and the SSA is working to update its systems accordingly. Notices will go out to beneficiaries explaining the specific changes to their individual benefits and what to expect. If you have not received a payment or a notice within the expected time frame, the most direct course of action is to call the Social Security Administration directly. Their main national toll-free number is 1-800-772-1213. And for TTY users, it is 1-800-325-0778. They are available Monday through Friday from 8 in the morning to 7 in the evening Eastern Time. You can also visit your local Social Security office in person if that is easier for you. And I know for many of our viewers, speaking with someone face-to-face is much more comfortable than doing things online or over the phone. Both options are available to you, and the SSA staff are there to help you understand your specific situation. one more thing I want to address before we wrap up, and that is the issue of scams. Friends, whenever news like this comes out, news about possible relief payments, news about benefit changes, news about checks being discussed, the scammers come out of the woodwork. They see seniors as targets. They will call your phone claiming to be from the Social Security Administration and tell you that you need to verify your information to receive your payment. They will send emails with links asking you to click through and provide your Social Security number and banking details. They will even show up at your door in some cases. Please hear me clearly on this. The Social Security Administration will never call you and ask for your Social Security number over the phone. They will never ask you to pay a fee to receive your benefits. They will never demand that you verify your banking information by clicking a link in an email. If you receive any communication like that, hang up, delete it, and if you want to be sure about the status of your payments, call the official SSA number yourself or visit ssa.gov directly by typing it into your browser. And please share this warning with your friends and family. Scammers are counting on people being excited about incoming money and letting their guard down. Do not give them that opportunity. The bottom line today, friends, is this. Congress has heard the voices of millions of seniors and disabled Americans, and while the fight for full financial security and dignity in retirement and disability is far from over, what was recently proposed represents real tangible relief that may be coming your way. Whether you are receiving Social Security retirement, SSI or SSDI, whether you are 65 or 85, whether you live in a big city or a small rural town, these changes are designed with you in mind. Taken together, benefits may better reflect the real costs you are facing. Your payments may include supplemental relief, your ability to work without penalty is being expanded, and your prescription drug costs are going to be addressed more aggressively than before. These are not small things. These are meaningful steps toward the kind of financial security and respect that every American who has contributed to this country over a lifetime of work and service absolutely deserves. We will continue to bring you updates as the implementation moves forward, as payment dates are confirmed, and as any new developments emerge from Washington. This is an evolving story, and we are going to stay on top of every single development for you because that is what we are here for. You are not alone in navigating this. You have this community, you have each other, and you have this channel committed to bringing you the facts, the details, and the real-world guidance that helps you make the most of every dollar you have coming to you. Thank you so much for spending this time with us today. Take care of yourselves, look out for your neighbors, and we will see you in the very next video.